Hello, this is a constipation tutorial presented by the SchrDbb with reference A Practical Guide to Issue Taking and Clinical Examination by Anwar Qais Saadoon. So, we're going to continue here with constipation. Constipation can be defined as difficult passage. It is defined as a difficult passage of hard, dry stools, commonly associated with reduction in. So, when you pass out hard and dry stools, that's already constipation. The second element in constipation is a reduction in frequency of stools, that is less than 2 stools per week, but it depends on but it all depends on your initial frequency. But that's a general definition of constipation. So the precise definition of constipation may not be easy to describe above most children. The frequency of movement varies with age. It reduces from more than 4 stools per day in first week of life to 2 stools per day by 4 months and 1 stool per day at 4 years. After 4 years, normal frequency of bowel varies from 3 per day to 3 per week. So that's it. So it depends just on the patient. So now we have the next thing is functional constipation is the most common cause of constipation in toddlers. So that just like toddler diarrhea or just like functional diarrhea of the toddlers that we just seen above here. So we've said there was toddler diarrhea, or the diarrhea was also called chronic non-specific diarrhea. So we have functional diarrhea is the most common cause of constipation in toddler. So it is much more present in the morning, and then there's no constipation in the night. So constipation. So identity. We have age. So the constipation issue, you're going to take identification. You're going to take the presenting complaint, the issue. The issue. You have the onset, the age of onset. You have the duration. You have the frequency of the stools. You have the characteristic of the stools, the consistency, the caliber, the volume. Is it bulky? Is it fatty stool? Is it foul odor? Is it hard? Form? Is it scabrous stool that's dried rabbit-like pellets or small amounts, thick and all that? You have, is it associated with fever, painful defecation, or just an anal fissure? Is there straining? Is there repeated vomiting? Is there abdominal pain? Is there distension and all that? Is the transition diaper to toilet, training, or home to child care or school? Stool widowing. So you have stool withdrawing behavior and water intake. Now the past history, you have the birth history. Maternal increase the incidence of small left colon. So when the maternal diabetes increase the incidence of a small left colon, that can cause constipation. Maternal drugs intake prior to delivery. You have opiates, you have magnesium, can result to constipation. You have prematurity, can result to functional ileus or even a meconium ileus. You have patterns of stooling from birth. You have delayed passage of meconium at birth, meconium ileus. You have neonatal complication. Past medical and surgical issue, recent illness, bed rest with this one complication of prolonged decubitus is constipation. We have fever, we have celiac disease, cystic fibrosis. Cystic fibrosis is also constipation in early childhood, but diarrhea in late childhood. Early childhood because it's going to be due to a meconium ileus. We have eczema, we have hypothyroidism can result to constipation. Diabetes result to constipation. Hirschsprung disease, congenital megacolon, also called congenital megacolon. We have spinal abnormality, we have anal fissure, we have surgery. We have medication issue. Recent use of medication, e.g. opiates, magnesium, aluminum containing antacids. You have iron, you have antihistamines, you have anticholinergic agents. Developmental issue, you have toilet training. Difficult toilet training may associate with encopresis. So toilet training, difficult toilet training may be associated with encopresis. That's a form of constipation. So the patient doesn't want to go and stool because he doesn't want to stool on himself. You have nocturnal enuresis, you have daytime wetting, you have school performance and absence. So feeding and dietary issue, type of feeding, poor feeding, transition from the breast to bottle feeding, recent change in diets, family issue of constipation, Hirschsprung disease, cystic fibrosis, celiac disease. So the next is the key point. The key point on constipation is the fact that stool withholding behavior with poor dietary and hydration habit is suggestive of functional constipation. Functional constipation is most usually when the patient is with a transition from diapers to the toilet, so or the patient just want to withhold, the child want to withhold the stools. Those one are mostly functional constipation. Is the most common form of chronic of constipation in toddlers. So especially in absence of alarming symptoms such as fever, anorexia, weight loss, vomiting, diarrhea, and all that. So if you have diarrhea and constipation at the same time, you can think of irritable bowel syndrome, which mostly occur in the morning. So if you have history of delayed passage of meconium, it can make you think of Hirschsprung disease, congenital malformations. It can make you think of cystic fibrosis. So we have blood in the stools. If you have blood in the stools and with constipation, which is painful, you think of anal fissure. So when an anal fissure, you have blood, so you have to find if an anal fissure is present. Urinary incontinence or other extra intestinal symptoms. If you have extra intestinal symptoms, it may be due to the compression of those extra intestinal organs onto the rectum, which results in the constipation there. So delayed passage of meconium during the first 24 hours of life may suggest Hirschsprung disease. Delayed passage of meconium during the first 24 hours of life may suggest Hirschsprung. So those are the things. Delayed passage, you need to know that what meconium should pass during the first 24 hours of life. With first urination should also be during the first 24 hours of life. But delayed passage of meconium within the first 24 hours of life, you have to think of Hirschsprung disease. First one. Second is cystic fibrosis. Third is hypothyroidism. Fourth is intestinal obstruction, and fifth is maternal jaw. So those are the 5 main things that you have to think when you have a delayed meconial passage within the first 24 hours of life. Hirschsprung disease, cystic fibrosis, hypothyroidism, intestinal obstruction, and maternal jaw use. Now, Hirschsprung disease should be considered in any child with a history of delayed passage of meconium, enterocolitis in early infancy. If you have enterocolitis, enterocolitis early infancy, constipation before 3 months of age, symptoms of intestinal obstruction, that is vomiting, abdominal distension. If you also have symptoms of intestinal obstruction, failure to thrive, and you have also a patient having trisomy 21, Down syndrome with constipation, you should always raise your suspicion for Hirschsprung disease. So from here, we are finished with constipation and go to upper gastrointestinal bleeding. Thanks for your kind attention.